This is my injury prevention plan, targeting for hamstring strain in a national level football player. The athlete is a 22 years old male winger named Leo, competing at a national level. 6 months ago, he experienced a grade 2 right hamstring strain. Although fully recovered clinically, he now reports tightness when sprinting, especially terminally. Manual testing show full strength, but there is some fascial restriction and eccentric and concentric imbalance, which aligns with evidence from Timmins and all in 2016. 14 demands of football winger. Wingers experience the highest sprinting load in football, engaging in repeated high-intensity effort, deceleration, and a directional cuts. Notably, fatigue peaks in the last 15 minutes of each half, which is a known window for increased hamstring injury risk. These biomechanical and metabolic demands define the context for intervention. The zone that are redder indicates the main sprinting lane used by the winger, which aligns with the tactical requirements of width and penetration. During an examination of these red areas, it is possible to track fatigue contribution, example, decrease red intensity as the half progression, and association of that with the risk of hamstring strain. Epidemiology of hamstring strain in football. Hamstring strain accounts for 12 to 16% of all football injury, with the re-injury rate as high as the 33%, primarily due to premature return or insufficient rehab, which is stated by Opar and al. In 2015. The bicep femoris long head is the most commonly affected muscle during terminal swing when eccentric load is the highest. Wingers, due to repeated sprints and high volumes, are among the most vulnerable players in game of football. Terminal swing phase is a critical where the hamstring contract eccentrically to decelerate the tibia, which is stated by Pfaff and al. In 2013. Two major risk factors are short fascicle length and a neuromuscular inhibition. These insights guide both the structure and focus of this injury prevention plan. Risk factors are divided into intrinsic and extrinsic. Intrinsic ones include fascicle length under 10.5 cm, eccentric weakness, and a previous injury, where extrinsic include poorly managed training loads, lack of sprint exposure, and a low rehab compliance. In this slide, we explored the three key periods during the season when hamstring strain risk is at its peak. First, during the pre-season phase, athletes often undergo a rapid increase in a sprint volume and eccentric loading, which can exceed tissue capacity. This risk is amplified in those with a short fascicle length or eccentric deficits, as identified by Timmins and Hall in 2016. Addressing flexibility, fatigue, and recovery in this phase is critical. Second, mid-season match congestion leads to accumulated neuromuscular fatigue, especially during back-to-back fixation. Five and all shows that this biomechanical fatigue raises the risk of hamstring strain, especially when combined with poor surface or load management. Finally, post-rehab return to play is a high-risk window. Athletes returning with incomplete eccentric capacity or poor neuromuscular control are significantly more likely to experience reoccurrence, particularly if previous autoregulation practice were lacking, as noted by Bone et al. In 2018 and Crozier in 2004. The overlapping circular model visually explains how modifiable intrinsic and extrinsic risk converge at critical points in the season to form a cumulative risk profile. This approach emphasizes holistic monitoring using health history, questionnaires, and interviews, which is stated by Hamstra and Wright and all in 2021. Slide outlines the key exercise forming the foundation of injury prevention plan. First, Nordic hamstring exercise decrease the injury by 51 to 70%, and its effectiveness lies in improving eccentric knee flexor strength, especially during terminal swing phase where injury often occurs. Next exercise like Romanian deadlift, hip thrust, and eccentric box drop target proximal hamstring and glute chain, which which improve posterior chain control and a sprint performance mechanism, both of which are crucial for injury resilience. Lastly, agility and neuromotor retraining are included to address coordination, deceleration control, and re-injury prevention. Sherry and Bash demonstrate that adding this element post-rehab significantly reduces reoccurrence. Overall, these exercises were selected for their high evidence quality, sport-specific relevance, and adaptability to gym or a field environment and illustrate the cyclic nature of the injury prevention plan. The process begins with risk identification using a screening tool, health history, and a performance testing to highlight individual vulnerabilities. From there, we move into the exercise phase where targeted intervention like eccentric loading or a neuromotor drills are applied based on the athlete profile. Next, monitoring and a feedback play a key role. RP scoring, DOMS tracking, and a sprint testing help guide adjustment and ensure appropriate progression. Finally, re-evaluation stage ensure that changes in strength, neuromuscular control, or a training load are captured and fed back into the next cycle of planning. This structure ensures the IPP is not a static, it adapts to the athlete's changing condition, fatigue level, and injury risk throughout the season, making it both dynamic and sustainable. Table outlines the structured 4-week progression used in injury prevention plan. Week 1 is the familiarization phase, where we introduce assisted Nordic hamstring exercise, Romanian deadlift, and a ladder to gradually load the hamstring and improve neuromotor control. Monitoring includes DOMS check and RPE logging to gauge early response. In second week, we move into the load development phase. Athletes begin performing full NHEs combined with hip thrust and ace skips. The target RPE is between 12 to 14, promoting progressive overload while avoiding excessive fatigue. In week 3, focuses on sprint integration, hurdles, bounding drills, and sprint efforts at 70 to 80% intensity help translate strength gains into dynamic sport specific movement. Sprint video feedback is used to assess form and reactivity. Finally, in fourth week, prepares the athletes for return to full play. Eccentric loading is tapered, and CNS priming drills are emphasized to maximize match readiness. A match checklist ensures physical and neuromuscular markers are met before competition. This phase structure supports adaptation, reduces overload risk, and aligns closely with football specific loading demands. Each slide presents the weekly microcycle structure designed to align with footballers' training rhythm while maximizing eccentric load, neuromotor adaptation, and a recovery. On a Monday, we begin with Romanian deadlifts and a mini hurdles to activate the posterior chain and develop baseline neuromotor coordination after the weekend. On Wednesday, we introduce high load eccentric work with Nordic hamstring exercise, hip thrust, and a ladder drill. This mid-week session is key for strength adaptation and control under fatigue. Friday transitions into a performance-oriented session using Romanian deadlift and agility sprints. The focus here is on sprint-specific deceleration, a known high-risk mechanism for hamstring strength. Saturday's session acts as a neuromuscular primer before match day using a ladder drill and a pre-match hop to stimulate CNS activation and directional speed. Finally, Sunday is reserved for recovery, incorporating foam rolling and a light dynamic mobility. These support facial unloading and helps manage soreness from the week's eccentric load. The overall structure is short targeted and adaptable to congested football calendars while ensuring adequate tissue stress and neuromuscular readiness. Precise load monitoring are essential for both injury prevention and performance enhancement. Starting with exercise cue, for the Nordic hamstring exercise, athletes should maintain their hip forward and lower their body in a slow, controlled fashion while keeping a neutral spine as recommended by Van der Horst and al. in 2015. The Romanian deadlift should be performed with a soft knee at a controlled tempo and with full hip hinge motion for maximal posterior chain engagement, which is stated by Bone et al. in 2018. During ladder or hurdle drill, cues include short ground contact time, fluid rhythm, and a synchronized arm drive, key elements for neuromotor efficiency as outlined by Sherry and Best in 2004. On the monitoring side, perceived exertion is tracked using RP scale from 6 to 20, post session to gauge subjective intensity. Weekly autoregulation is logged combine volume, intensity, and recovery readiness. Finally, objective field-based tests like single leg hop distance, splits times during sprint performance to dictate the process of progression and readiness, which is stated by Pfaff and al. In 2013. Prevention plan is evidence-based and practically structured. Several real-world barriers can limit its effectiveness, especially in elite football setting. The first is DOMS. High eccentric load exercise like Nordic hamstring can trigger significant soreness in the early stages, which can reduce athlete motivation and adherence, which is stated by Bond and all in 2018. A second major issue is staff buy-in. Coaches often prioritize tactical and performance drill over injury prevention unless they clearly see performance benefits. Equipment limitations are also common. Many exercises, such as hip thrust or resisted sliders, may be constrained by excess of benches, bands, or appropriate surfaces. Crowded fixture, especially midweek games and reduced training slots, make it challenging to consistently implement a structured IPP without overwhelming the athlete's schedule. Finally, player resistance can be an issue. Some athletes perceive IPP work as a time consuming or uncomfortable, particularly early stage exercises like the energy that can induce soreness. This barrier must be addressed through the smart integration, communication, and a gradual exposure to maximize program adherence. To address the challenges highlighted earlier, these slides outline some practical and scalable solutions to enhance some adaptation of IPP. First, phase introduction and a pre-match integration ensures that injury prevention elements are introduced gradually in pre-session and embedded within familiar warm-up routines. Next, showing a connection to performance metrics such as improved sprint mechanics and reduced injury rate helps motivate both players and coaches by linking the IPP to on-field benefits. For time constraints, S and C session integration keeps session under 30 minutes and pair them with gym-based lower body work to prevent scheduling conflicts. To counter equipment limitation, we use low equipment adjustment like towel sliders, towel benches, or a simple bodyweight progression that maintain effectiveness with a minimal setup. Engagement is boosted using shared monitor tools such as a Google Sheet or basic athlete apps like RPE check-ins, fostering communication and accountability. Finally, coach education through brief session or explainer videos highlighting, for example, the 70% injury reduction seen in NHE programs can significantly improve coach buy-in and support for long-term implementation of the injury prevention plan. Provide a critical evaluation of injury prevention plan, reflecting on its strength, limitation, and suggestion for future enhancement. Strength-wise, the IPP uses a multi-phase progression model that supports gradual adaptation and overload. Its design is supported by high-quality evidence. It's also practical, requiring minimal equipment and are highly adaptable due to the inclusion of auto-regulation and field testing to tailor the plan to the individual needs. However, there are few limitations. Key assessment tools like ultrasound are not widely accessible in most applied settings. Additionally, much of the supporting evidence is based on elite male athletes, limiting generalizability across the broader population. Finally, real world can use vary due to inconsistent buy-in from coaches or athletes. To enhance the plan, some suggestions include conducting pre-session assessment with tools like Noteboard. GPS accelerometer must be used to track sprint load, engage in brief laps so as its increased buy-in, or monitor RPE and soreness every 2 weeks to assess the needs to change in the loads. To conclude, hamstring strain remains a significant concern in high-speed athletes, especially during the terminal phase of sprinting when eccentric demand and the neuromuscular fatigue are highest. This 4-week injury prevention plan integrates eccentric loading primarily through Nordic hamstring exercise along with neuromuscular retraining and auto-regulated progression. It offers a phase-based, evidence-backed strategy to address modifiable risk factors while aligning with the physiological and tactical demand of football. The weekly structure is intentionally designed to match football scheduling, starting with recovery, building load midweek, and a tempering before matches, minimizing interference with technical training. Effective implementation requires a strong collaboration with coaching staff to ensure adherence and a seamless integration within the athlete's routine. Finally, ongoing monitoring through RPE, sprint metrics, and a soreness feedback is a key to maximizing availability and minimizing the risk of reoccurrence, especially during congested competitive periods.